And I really, really think that we should take misinformation as if it's a pandemic itself and treat it as one would. It's an emergency situation, and it needs to be dealt with by reestablishing trust in public health organizations.
Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change.
Today, to help us address this topic, I'm very pleased and honored to have Carrie Cullinan, who is with the Health Policy Watch. Hi, Carrie. It's such a pleasure to have you on the podcast today.
Hi, Kemi. Thanks so much. Very big topic.
Yes, very big topic, but it's also one that is not often talked about in terms of how significant the media is. Just for the benefit of our listeners who may not know Carrie or even the Health Policy Watch, let's start off with what the Health Policy Watch does. What is your role in that?
So Health Policy Watch is an online platform based in Geneva. And its whole mission is, Geneva is where the headquarters of the World Health Organization is. And it was started with the idea of trying to bring those sort of big global policies to the regions and local levels with people who are really affected. So trying to get people from developed and developing countries together on one platform. So we have a lot of reporters, freelancers from developing countries, particularly from Africa. And then we also report back on the Geneva-based news. So it's trying to cross-pollinate the two from local right up to global.
What's your own background and how did you come into all of this?
So I'm a South African. I'm usually based in Cape Town, although for the winter I'm just sitting here in New York.
You ran away from the winter.
I did. Believe it or not, Cape Town winters are horrible. So for years, I ran a public health news agency in South Africa, and we supplied mainstream media, TV, radio, and print with health news. But more and more, I got a flavor for and an interest in global health. So the last sort of section of my job, we were working with a Bloomberg Philanthropies sponsored food policy program, and that brought me in contact with people from Mexico, Colombia, and so on. And I loved it so much that I wanted a bigger platform, I guess. So I moved into working with global platforms, and then the pandemic came, and so Health Policy Watch was a good perch for me.
So how has that been for you so far?
Look, it's enjoyable. It's very fast and it's huge because I write a story a day. I wake up in the morning like, what are the huge issues of the day? And then we just hit and punch. I mean, before I got onto this podcast, I was finishing off a story on Ebola that I just finished like minutes before hopping on. So the pressure is big, but it's very interesting.
We know that the media is crucial in public health. There's no denying that. We've seen even right from the days of HIV, AIDS, even, whether it's Ebola, Mpox, COVID, we've continued to see the role that the media plays, particularly in being able to break down complex science or medical information that are easy to access for communities and for them to be able to understand. New media is making it faster, even for organizations to reach communities and reach people with information effectively and efficiently. I wonder your thoughts about that in terms of them being able to drive credibility when it comes to the media.
The rise of social media has meant that there's just like a chorus, a huge chorus of lots of voices and lots of people wanting attention. And the traditional media, it's very hard to compete with a massive chorus. So I think what we have to do is to just continue to produce fact-based information so that people know that they can trust us, so that we are a reliable, constant source, and that we don't dramatize and we don't try to push people and we don't try to make people scared. I think that because we can't compete with the speed. and we can't compete with the trolls, and we can't compete with the indignation, because there's a lot of emotion in social media. People are always like, oh, this and oh, that. We can't be in that space. We just have to be calm. We just have to establish that we are a trusted voice and not try to get in the mix of that sort of scramble on the ground.
So how does Health Policy Watch approach that?
Every single day we are writing about health news. And because of that, if you search online, our stories often come up first because there are many of them. We produce a large body of work, and we make sure that our sources are very credible. We try not to pronounce on, COVID was caused by this or COVID was caused by that. We say this is what some people say and this is what other people say. But the health messages we take from health experts, not from, uncredible or unreliable sources, and we base it on science. So there should be published papers, scientific experiments that prove that this or that treatment works. And that's how we approach things from an evidence, science-based point of view.
That's also something that oftentimes people flag. It's, the having unverified information, or we saw that even during COVID when people talk about how you can treat yourself. And we had all sorts going out, people talking about drinking bleach and different things that were said. But even in HIV, how sometimes the narratives have fueled stigma even more and not being backed by science. So I like the fact that you're highlighting that, because I do feel, or maybe I should ask, do you think that the media does invest enough time in investigative journalism, health journalism, making sure that they get the information that they need? Because in a time of fast-paced news, you and I know that everyone is so quick to want to break the story. Only very few do the work in terms of verifying the information, the data. And since that's something that Health Policy Watch is very keen on, making sure that the information is verified, it's evidence-based, how do you think the media can continue to strengthen that? Because I think that part is missing a lot, don't you think?
I agree. But the big problem is the media has lost a lot of money because the money is now going to the big tech platforms. So the advertising and so on that used to be revenue that would go to online platforms goes now to Facebook, to Instagram, etc. And so there's very little money in media, and we all know that investigative journalism takes time and it takes money. So I think the pendulum is swinging slightly back to people are now understanding that if they want quality, they need to pay. So there's a lot of the rise of the subscription-based publications. But of course, those then are for the elite. And then ordinary people who can't afford it, particularly on my continent, Africa, it means that a lot of people still get their information from the tech platforms. And they have just abdicated their responsibility for making sure that they are not pushing out misinformation. So I almost think that, sure, we can't compete with them, but what should happen in countries is that they should regulate the big tech companies. Europe has started to do that. They have a Digital Services Act, which holds the big tech companies responsible for misinformation. It doesn't happen in the US. It doesn't happen in most African countries. And I think that is something that needs to be put in place, because otherwise we're all scrambling. They gather all the money and they make money off misinformation, because that drives people. People are excited by the gossips and the drama, and that drives viewers and readers and listeners.
When you talk about the fact that you raise the issue of tech companies, it makes me think about even how AI now is being used to generate content for public health, and how much of that content is really verified, right? So you highlighting the importance of, having policies that ensure that misinformation doesn't, it's not the norm, because we do have a serious crisis of infodemics whenever we do have any form of public health emergency or crisis that we face. But even the day-to-day health, information that people need. Because I can think sometimes you go on Google or someone has a symptom and the next thing they're doing is they're Googling to try to understand what the symptom is. I think that's very important in terms of the bit of policy. And I feel the media can also play a role in amplifying the need for stronger policies, right? When it comes to misinformation or disinformation.
I agree. I mean, I've got a friend who is a doctor in public health, and she says Dr. Google causes a lot of trouble because a lot of people, they'll Google their symptoms and then they'll come convinced that they are on death's door. It makes you alarmed as well. It doesn't help.
So what do you think that the media can do in terms of building public trust? Because sometimes the media plays a strong role in shaping public opinion. And we know how sometimes because of the dynamics between the important role of the media, which is why some people say the media is an ally. And then there are people who say sometimes the media can be an adversary, right? The thing is, when we have that kind of dynamics happening, how then can we ensure that, we continue to amplify, one, the importance of the media amidst all of this that we're seeing, whether it's new media, whether it's traditional media? How do we continue to ensure that its significance is never lost, even in public health? And also bringing the media even closer to public health. How do you think we can strengthen that?
So the media is very big. And I would say that definitely there are some portions of the media that you don't want to work with, that are chasing sensation because that brings them clicks and views and so on. So the best thing for an ordinary person or for an organization that wants to work with the media is survey the landscape, find out who the reliable allies are, and then try to find journalists who work with different outlets.
Do you think the media has its rightful place as a partner in public health or no?
I think a lot of partners don't trust the media, but with health reporting, a lot of the time we get embargoed news. So people will send us a paper that's about to come out, which is really important. And they say, we'll send this to you, but you have to promise not to publish it until a certain date and time. So it gives you like maybe 3 days to read it, to understand it, to ask them questions before you write your story. That's a really good strategy. I think that works. And also inviting the media to join media briefings and having regular briefings, especially, for example, now with the crisis of this Ebola outbreak. There are a lot of press conferences being called by the Advocacy CDC and by the World Health Organization. They call together journalists and they allow journalists from all over the place to ask questions. It's very helpful because then it makes sure that everybody has access to experts and the experts can understand and what people are concerned about, can answer any questions and can allay any kinds of fears or misinformation.
For one, I think for a long time that the media oftentimes is not treated as a key partner. More like most times people call the media for reportage just to report a story, or we have this event that's going on, so we want you to cover it. And even as you engage the media, then you hear them say, we are also key partners in this because you do need us to get the information to the people. So it will be good if we're not only thought of when you have a story, right, or a news to report. So like what you're saying, yes, it's on Ebola, but it's also that continuous engagement, even after the trends or the wave is calm, that continuous engagement of keeping us, in the loop, keeping us. And I wanted to find out from you if you've also encountered that and what you think are some of the ways that global health partners or governments and even organizations can build that partnership with the media in a way that is not just once in a while or when there is a breaking news, right?
I think if you're a big organization like the World Health Organization, for example, they may have a media briefing at least every 2 weeks. And that's open to any journalist in the world. and it's an online platform. I think that really helps. So if you are a big player, there's always something going on. So you have this regular briefing, and whoever wants to show up, shows up.
And how do we ensure that we keep certain conversations going even after trends have died down? So I'll give you an example. When we look at HIV, now there's a lot of conversation around new prevention tools, right? Like lenacapavir and, but then we still see that tools such as condoms are still very effective, but yet not much is talked about it in the media. So how do we, from your own perspective and your work, I know, yes, a lot of what you focus on is also on global health and policies, but how can we ensure that the media is not only driven by the trends, but can still ensure that a lot of content or a lot of information, such as preventive measures, still remain at the forefront, even amidst all these other things happening? Because again, the reality is that where the media goes, the people follow, right? Because whatever it's dominating the news, that's what people are listening to. So how do we ensure that public health information, even if they may not be the headlines today, but they're still relevant in terms of promoting public health or behavior change, how can the media ensure that that still continues?
Okay, that is a challenge. I mean, HIV is a passion of mine. I started off as a I was a political reporter and moved into reporting on health because HIV was the biggest issue in my country, South Africa, because that was the epicenter of HIV. So I think what you always have to do is persuade journalists why something is important. So, for example, on the use of condoms, people might think, oh, that topic has been covered 1 million times. But what we need to remember is young people are growing up all the time and they're becoming new consumers of media. So you need to repeat the message many times over to get to the people that you want to, because the audience is always changing or always maturing. So I think if you're trying to persuade a journalist or persuade media that a certain topic is important, human interest stories are always the best. So, try to tell them about, somebody who could have avoided infection if they'd had access to condoms, or try to tell them about how certain schools will not allow condoms to be distributed in the schools, even though they might have a very high teen pregnancy rate. Those kinds of things that make people understand, actually, you can write this in an interesting way, and that it is, because people are always fascinated by sex stories. So, you can, it's the truth of it. So you can package them in a way that make people understand the importance and also understand that it makes a good story.
I like that you raise human angle stories, because I feel that's missing a lot when we talk about public health or even global health. So it's important that, stories are used, because that's also one of the ways that, right, people connect to an issue is when they see themselves in that, maybe humanizing it. But I also see that it's a way that allows for people to take such complex public health issues or discuss and, make it relatable for them. So the fact that you highlight the importance of human stories, I appreciate that, because we need more of that in public health and global health.
100%. I mean, I was thinking this morning while I was writing my Ebola story, we're talking about suspected cases and testing suspected cases. Suspected cases are human beings. They're not just suspected cases. They are people. They have families. They are families who are terrified, And I think even the language that we use is important to make people understand we're talking about people, not just things.
What would be your own thought in terms of how do we ensure that the media continues to take global health policies and ensure that they get to communities who may not be in those rooms, who may never have the opportunity to be in those rooms, but yet those policies will impact their lives. So that's on one hand. And then on the other hand, ensuring or holding governments and leaders accountable to see that, as you make these policies, you also need the voices and the inputs of communities. What do you think the media can do to help that?
I think the whole pandemic agreement discussions and so on became very abstract for people. And to try and bring it down to reality, I think that is the job of journalists. And even I think I'm guilty of reporting on some of the technical stuff. And sure, the technical stuff is important. And our readership is generally fairly knowledgeable, but not completely knowledgeable. So we always have to repeat, what is this all about? And then when you have outbreaks, hantavirus and Ebola and so on, then people suddenly remember, oh yeah, actually, we can have a pandemic anytime. And then once again, the pandemic agreement talks become important again. So it's sad, but it's true that sort of adversity and bad things happening remind people of why we need these global policies. And there's lots of misinformation going on, lots and lots and lots at quite a granular level. There's the information and then about the pandemic agreement. And then there is a whole lot of people who are working to twist it for their own political views. And I think that is not being contested by the media very much at all, if at all. And I think that that's a role that we need to play, getting in there and correcting this information.
I agree. Yeah, we should. So I think it's something we can also take away from this. And I guess our listeners can take that away, that you also have the right, if you hear an information that you know is not true, to get the media the right information so that goes out ahead of it. And on the issue of accountability, because that also, it's holding them accountable, calling it out. And because the media is so vast, there are many ways that you can creatively bring a policy issue down to communities, whether it's through visualization or storytelling, or even just being able to use simplified languages that they can connect with. And I see the need for us to continue to do that, even as new media continues to dominate. But I'm also thinking about it that it creates a good opportunity to also connect with traditional media, right? New media and traditional media being able to work together, because sometimes you need your radio station radio is still very popular for a lot of countries on the African continent. Mm-hmm. It's one of the ways that the farmer listens as he goes to the farm, or even as people go to work, they turn on their radio. So do you think there's a space there where new media can come together with traditional media to ensure that we continue to make sure that not just only the accurate information, but simplified information can get to communities?
Look, radio stations are incredibly important. And I think that there's often not enough engagement with them. So I would say that if you have a public health message, radio stations, particularly in African countries, are essential. And as you say, they reach people all over the place while they're busy doing whatever they're doing. You can listen to the radio while you're driving, while you're in the taxi, everything. So I don't think there's enough of it, and I don't think it's sustained enough. But again, also, to be frank, the global health sector has lost a huge amount of money. And what always goes first is the money that they pay for media engagement. So that's really unfortunate, especially on HIV. We've seen it, HIV and TB in our country, in South Africa. There's that sort of pillar has almost fallen away completely.
So how do you think Health Policy Watch can, or is, demonstrating leadership around some of this in terms of whether it is getting the information to communities or, ensuring that the role of the media continues to remain relevant, even as we see a dwindling in funding and, of course, shifting priorities? How is Health Policy Watch showing leadership in that?
We are also struggling for funding. I need to just say we're a non-profit, and so like every non-profit, we are all struggling. But I think our approach is that we try to use local reporters. So we try not to have the helicopter approach where somebody comes from a Western country and pops into wherever. In the perfect world, if we were fully funded, and so we would have dedicated reporters all over the place. You can get the local flavor of things, because although lots and lots of things are online, it's hard if you're not a reporter from a particular country to know if what you're hearing is true or not. We try as best we can to work with people from particular countries, so you get a different flavor. We have reporters from a lot of countries in the world, and we even have a woman reporter who was based in Afghanistan, which is quite amazing. And she, unfortunately, she had to flee the country now, but she reported on the impact on women's health on the conflict and the repressive leaders and stuff like that. It gives a different texture to the stories. So I think that is one of the things that I'm passionate about at Health Policy Watch, and that we're trying to build out, is a whole network of freelancers who are based in the countries that are most affected.
Do you see an opportunity to also engage with local traditional media as well?
We are quite happy if local media takes our stories and republishes them, as long as they give us, the acknowledgement. And I think that can help. And it's an efficient way of distributing news. Instead of many people covering the same thing, you could have a few people, and then those people can use your work. So we would like to develop that more, is partnerships with the local media, and that they know that they can use our stories, free of charge. It takes a while to build up a network like that, but it's definitely an effective way of reaching a lot of people.
Yeah, because I think there's an opportunity there in terms of, how online platforms or digital news platforms and traditional media can actually collaborate to make sure that, there's a flow of accurate information, whether from digital to radio, that way becomes more accessible to people. So I do see an opportunity, and perhaps it's something that we can continue to think about on how we improve that relationship. Because I think it will also be helpful in terms of when we talk about simplifying messaging or localizing the message, whether it's a policy issue or a behavioral health issue or whatever it is. And when you were talking about the fact that Health Policy Watch uses local reporters, that made me smile, because it kind of reminds me of AHF, because with the AIDS Healthcare Foundation, the staff on the ground are locals. You made a point to say there's a different texture to it. Someone from the community understands the issues, knows the language and how to communicate and reach them. And that's also something that AHF does in terms of our staffing in all our countries are locals. So I could connect with that. I think that's something that we need to amplify more when we talk about the media in public health, is to also leverage local reporting, right? Leverage the people on the ground, because they can help make those connections sometimes. And you know how it is sometimes when someone comes from outside and in, people sometimes are not very open to engaging. There's some form of, either mistrust and all. And those are things that local reporters can help with. So I'm happy that you raised that. That's a model that Health Policy Watch uses, because we do need more of that when it comes to the media.
You hit the nail on the head. A local reporter will be able to tell if an official is talking nonsense or not. Whereas if I'm coming, called into a country and I'm listening to them saying, yes, we have this or that or the other facility, I wouldn't know, because I'm not from there. So local people checking whether what they're saying is accurate is incredibly important.
If you could change anything right now, what would that be in terms of how the media ecosystem engages with public health or global health? What would that change look like for you?
I'm not sure whether I have a blueprint for change, but what I'm really concerned about is the rise of dis and misinformation. And I don't think that it's being addressed seriously enough. if you look at just the last two outbreaks, hantavirus and Ebola, we've had Ebola facilities burnt down because people have misinformation. We have around hantavirus, we had people saying it was made up, it wasn't true, it was engineered in a lab for people to make money out of vaccine. The same stories from COVID. And those things spread very, very quickly, and they undermine people's confidence, and they also make people confused. And I really, really think that we should take misinformation as if it's a pandemic itself and treat it as one would. It's an emergency situation, and it needs to be dealt with by reestablishing trust in public health organizations.
So when you talk about the media and politics, I wanted to find out, do you think it's possible for the media to not be political, even in public health?
I think that in public health, you've got the best opportunity not to be political, because I've yet to come across a health reporter who doesn't want people to be healthy. So I think at least we can agree on that, is that you want people to be healthy. Of course, there are different interpretations about what healthy is. But I think, unlike being a political reporter, which is how I started in my career, I was first a political reporter. You have to be careful not to take sides in party political positions. That is sometimes tricky because you are a human being. But with health, it's easier to say, I want everyone to be healthy. And because I want everyone to be healthy, I think that they should have access to this information. But obviously then, as things evolve, politics always comes in. If you look at COVID, the origins of where the coronavirus came from was highly politicized, and it remains highly politicized today. So yes, politics always creeps in.
Yes, it always does. But yeah, I think health journalists, having the ethos of wanting people to be healthy, that should be the driving force in how you approach your news reports, right? Or your stories around it, or how you engage with public health. I'm just wondering, in terms of when it comes to media, representation in public health. So representation as well as diversity of voices. Is that something that you think the media is doing well? Are there areas that it can do better in terms of making sure that the media itself does not reinforce inequities when it comes to public health?
I think our approach, Health Policy Watch approach of using the local reporters, is part of trying to ensure that there is a diversity of voices, and also that the right people are representing their own countries and their own views rather than outsiders. I don't think the media is doing a particularly good job. I think, you see the same kinds of people often reporting on things. And it's not only race, but it's also class. Because certainly in my country, people who have money, they go through private health, whereas people who don't go through public health, and that's 80% of the population. So if you wanted an accurate report on what is happening health-wise, you should get somebody who's using public health. And mostly, those are not the people who are in the middle classes who are the reporters. So I think we have to have an expanded view of diversity, not only race and gender, but also your class background. It's war on diversity. It's almost made the attempts to particularly elevate Black people and women into positions of power. It's given people free pass not to do that anymore. And I think that that's a shame, and I think that's a huge mistake.
I agree with you, because we do need more representation and also diversity of voices. And yeah, it's not just about race or gender, because the truth is sometimes we see that, when you're looking at the media, you kind of see that sometimes information is skewed towards a particular demographic, or, there's certain voices that are not represented. Or if you're reporting on an issue and you're not reaching those who are most vulnerable to share their lived experiences. And so you end up having just information from those who may not directly be affected, but seem convenient, or looks like the good look or how it's portrayed. I think we can say the same for even the narrative framing, how it is framed when you talk about whether it's the global south or the global north when it comes to public health, and how that the media can play a role in ensuring that the narratives do not demean certain populations or do not reinforce those inequities when we're talking about public health or global health in general, or whose voice gets heard or who gets seen on the issues. And yes, I agree with you that the media is not doing very well in that. And that's an area that we need to strengthen, because it's also an area that helps us know who is really affected by the issue beyond just, and what kind of narrative is used. Is it empowering or is it disempowering in how it is framed?
For me, I'm very passionate about the undermining of vaccinations. I mean, vaccines are one of the greatest scientific discoveries of all time. They have saved millions of lives. And for me, it is the epitome of privilege to undermine vaccinations. Your children can go to their private play schools and be unvaccinated. They're not going to be at risk. But you export this anti-vaccine message to poor countries where people have children who are living in informal settlements, who are going to schools with many, many children who don't have access to clean water and sanitation, and they're unvaccinated. They can die. I feel absolutely passionate about that.
I do have on my note here vaccine hesitancy, but now as you speak, so it makes me wonder. So do you think the media is it that ethical and moral authority to not push anti-vax messaging, but rather amplify the importance of vaccine and science and, in terms of helping to address diseases?
When the World Health Organization's head of vaccinations, when they have press conferences about vaccinations, she always answers that the biggest reason why people are not vaccinating is because they simply don't have access to vaccines. Because in their countries and in their communities, they are too poor, their governments don't get to them, and that is the main reason. And we should just be reminded of that it's because in poor countries where people really need vaccinations, they really want them, but they can't get access to them. That's becoming a huge problem. You'll see that there are measles outbreaks. And sure, we certainly don't want measles outbreaks in our own countries. But because the message is coming out stronger that vaccinations are not that important, it's undermining the desire for people to vaccinate their kids all over the world. And it's terribly irresponsible.
Yeah, and the media, there is evidence, there is science to show that vaccines work. And so the media also has that responsibility to amplify, what the science tells us. And what I think it goes back to the conversation we're having about media being politicized, because I'm not taking sides, but going with what does the science say? What does the evidence tell us when it comes to the importance of vaccines, whether it's for COVID? Because we also saw a lot of vaccine hesitancy during COVID, and part of it was also fueled by the media, right? So it's that sense of responsibility and duty that the media has. I think even as we continue to talk about the importance of the media, it's also important that the media itself, a lot of, recognize the sense of duty and responsibility that the media has when it comes to global health or public health, because this is a life or death situation. And it's one that, in terms of integrity, the ethics, socially, whatever, you have to uphold the highest form of, there's accuracy of information, because it also goes back to building that trust at the end of the day. So the role of the media cannot be overemphasized when it comes to public health, just going by everything we're talking about on the issue of vaccines. If you were to speak with, let's say, upcoming journalists who have interest in public health or global health, what would be one key advice you give to them?
So my advice to a young journalist would be, first of all, it's hard to get into the media. So we need to acknowledge that up front. So what I would suggest is to start just by attaching yourself to a publication or an outlet that you enjoy and showing up and offering stories and seeing whether you can intern and learn. But on the other hand, I also would highly encourage you to look at health, because health is fascinating. It's something that it's like the lowest common denominator between all people, whether you're rich or whether you're poor. If you have ill health, if you are sick, your quality of life is impacted. So don't discount health. Don't just go for the big sexy topics like politics. There's lots and lots of politics in health, and it's really, really interesting.
Yeah, those are very good nuggets there. And when you talked about the fact that health is fascinating, it's a common denominator. It makes me think of how we've seen health no longer being prioritized, especially when you put it vis-a-vis things like security, climate change, and all. We've noticed over time health is not being prioritized. Perhaps the recent cuts that we've seen in aid and, is helping to bring it back up. But I just wonder, from your experience and maybe from Health Policy Watch, how do you think the media can continue, given just how passionate you feel about health, to ensure that health is prioritized every time? Because it is very important.
What is fascinating, and the silver lining of the AIDS cuts, is that particularly on the African continent, African countries have had to step up. They've lost huge amounts of their income and their health budgets. And so there's a whole resurgence of interest and also commitment from African countries to allocate more of their budgets to health. So I think it's certainly happening here.
Yeah, thank you very much, Kerry. And it's been wonderful having this conversation with you on the role of the media. I want to pivot to something that we normally do with guests on this podcast, and that is what we call the fun questions. So we normally have a fun question segment where we just get to know you a bit more and want our listeners to also get to know who you are beyond Kerry of Health Policy Watch. All right. Now, the first one is, if you had to choose between road trip or air travel, which would you choose?
Road trip.
If you were an ice cream flavor, which one would you be and why?
Chocolate, because it's the best.
Okay. So what was the last book or article you read?
I read an article about Ebola this morning, actually.
What's the last movie you watched?
I watched a movie on a plane called Song Sang Blue. That was the last movie I watched.
Oh, yeah. That's the one with Hugh Jackman, right?
Exactly.
Is it that one? Okay.
Hugh Jackman and Kate Hudson. Yeah.
Kate Hudson, yes.
It's a sweet movie. Mm-hmm.
Okay. Now, who is your favorite musician or band?
Ooh, I have quite a few, but I think my enduring love is for Nina Simone.
Oh, Nina Simone, the great Nina Simone. Great. All right. If you could have a superpower, what would it be?
A superpower would be to end greed tomorrow.
End greed tomorrow. Why not today?
Okay, today. Even better today.
All right, Kerry, thank you so much for coming on the podcast. It's been such a pleasure having this conversation with you on the importance of the media when it comes to public health and addressing some of the misconceptions, controversies, or sometimes the challenges that we face in terms of media involvement and engagement with public health. It's been such a pleasure.
Thank you, Kemi.
Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going.